Nagar Road, and I have my clinic by the name of Kid Care Pediatric and Neonatal Clinic in Hadapsar, Pune. So today's topic I'm discussing about the allergies in babies, which is quite common topic. So we'll discuss in a brief regarding the this topic. So to begin with, what is allergy? What defines allergy? Okay, in a very basic manner, I will try to explain. Okay, so allergy is an abnormal immune response of the body to the particular substance, which is recognized by the body as a foreign substance. Okay, so generally we call it as an allergen. Okay, when allergens enter into the body, this allergic reactions happens. So these allergens or substances can be of various types. Some are airborne, some are food related, some chemical related, or some insect bites related. So this allergy happens in the body. So we'll discuss in brief regarding that. So when this substance or allergen enters into the body, so these allergens or substance recognized as a foreign object or a foreign substance in our body. So this certain amount of antibodies get produced in our body to protect our body from this unknown substance. Okay, and these antibodies send some message to the particular type of cells which releases certain chemicals, and that chemicals is responsible for the allergic reactions or allergic symptoms or the signs in the body. The commonest chemical is histamine, which is released, and there are a lot of other chemicals which are releases, but that is not the point of discussion now. Just a brief idea regarding the mechanism how the allergy happens in the body. Okay, so there are a lot of different type of allergens in the environment. So grossly, we'll categorize these allergens into three categories. One is airborne allergens, another is a food-related allergens, and the third category is the miscellaneous kind of allergens. So airborne allergens generally, lot of we know, hmm, like dust allergies, housemates, generally allergies, then a lot of pollens in the air, then scent related allergies or the perfume related allergies. These are the generally commonly airborne allergens we encounter. Some pet related threads or pet related hairs, okay, can cause allergy in the children's. Certain insects like cockroaches have certain amount of airborne allergens that may again can cause allergies in the children. So these are the commonest airborne allergens in the body. Then the second type is food allergy. Food allergens commonly we in day-to-day practice we encounter common allergies like milk allergy, milk protein allergy, and then the egg allergy, meat allergies like chicken allergy to chicken, allergies to some non-veg products like fish, shellfish, all these things. And third is some vegetables or nuts kind of allergies, like most commonly seen is a peanut allergies. Whenever children eats, they might develop certain kind of allergies. And miscellaneous like chemicals, some beauty, some products which is having some chemicals can cause allergy, like cosmetics we use, some moisturizer we use. Certain amounts of the chemicals in that may cause allergies in the children's. Then the insect allergies, some insects bite can gives rise to the profuse allergies in the children. Okay, and drug allergy, which is very commonly observed. Some children are allergic to particular type of drug, like some kids are allergic to ciprofloxacin, some kids are allergic to amoxicillin, some kids are allergic to ibuprofen, some are allergic to paracetamol. So these common allergies we generally encountered in day-to-day life. Okay, so these are the common allergens we encountered in children's in our practice. Now, how this allergy presents? Okay, so how this allergy presents is varies from the different perspective of the patients. Some develop full blown symptoms, some may develop a little bit of symptoms. Okay, so symptoms may involve your eyes, your nose, lips, throat, lungs, intestine, stomach, and large organ of the body is skin. So all this depends on the type of allergen. This kind of allergies may start showing the symptoms. Okay, if allergy happens around the eyes, then there might be some redness of the eyes, some watering from the eyes. There may be foreign body sensation, maybe some irritation in the eyes. Generally happens in the nose. There may be sneezing, running nose, stuffy nose. All these symptoms happens when allergic symptoms develop in the throat or the palate, and then you develop irritation in the throat, so irritation in the hard palate. There may be difficulty in the breathing. Okay, this kind of symptoms when the allergic symptoms develop in the throat. Lungs again, there is difficulty in breathing, severe coughing. All these symptoms. In lips, there might be swelling of the lips, redness of the lips, and all these symptoms generally we encountered when allergic response get mounted because of the allergens in the children. In stomach, there might be vomiting, there might be diarrhea, loose motion, abdominal cramps, pain, all these symptoms. And very rarely, in some type of kids who are very allergic to the particular substance, might develop a life threatening events in the form of there is a swelling over the our throat, inside our throat, what we call as a laryngeal edema, which is a very life threatening complications happens when children develop allergy to the particular substance, like mainly commonly observed in cases of the allergy to the fish, allergy to the non-veg eggs. In such cases, these kind of generally encountered, and few children we receive in our emergencies with such kind of symptoms. Okay, so is this allergy, why this allergies happens? Okay, is there any specific reason? So most of the allergies are genetic origin. Okay, genetic origin means the familial allergies are known in the child's father or the mother. Okay, it is found that when the father is allergic to the particular substance, okay, so then there is chances of 40 to 50% of the cases the child may develop allergies. And when the both parents are having allergic symptoms or allergic tendencies, so there are 70 to 80% of the chances in the kid to have allergic tendencies. Okay, so most commonly seen as a genetic relation of this allergy belong to the parents. Okay, but not happens in all cases. When you see that mother or father having a allergic tendency but child may not have, okay, which is commonly seen. Or sometimes it happens that child may have an allergic tendency but parent doesn't have. So spontaneous origin of the allergies also well known in the children's. Okay, so this is the brief idea why allergy happens, how allergy happens, what are the symptoms, and all these things. Till now, I have covered. Okay, and now how to diagnose what kind of allergy uh, and which kind of allergy. What how can I find out my child having a allergy to a particular substance? So there are particular tests. There are two or three types of the test we generally conduct in the children's when we encounter such kind of allergic symptoms. Okay. So one is a skin prick test. Okay. So we try to find out the common allergens. Okay, which are like sensitivity towards a particular allergen in the form of IgE sensitive stick. We generally do the skin prick test, commonest allergen we choose, and we try to do the skin prick test. We generally put the patches over the forearm with the typical type of the allergens, and we see the response over that strips. So it shows some kind of a swelling or some kind of a reaction to the particular kind of a substance. Like some children show the particular response, allergic response to the peanut antigen, then some egg antigen, some fish antigen. So like that, we come to know that the child is allergic to the this kind of a substance. So this is the skin prick test. Then another kind of test is a blood test. Okay, we do the test when the children's having some kind of a skin related issues or a acute onset of the skin related allergy. So there might be a certain kind of a rash over the skin or some lesions over the skin. So skin prick test will not be possible. In such cases, we do the blood test. Blood test generally, again, the same thing we do. We try to extract IgE levels of the different allergens in the body, and to detect what kind of a specific antibodies are getting developed against which particular antigen. Okay, so like that, we come to know that the child is allergic to the egg proteins, child is allergic to the milk protein, or some vegetable proteins, or some insect protein, airborne allergens like dust mite, house mites, all these things. Okay, and third kind of a test we generally conduct, which is not common, which hardly conduct in rare situations, like a challenge test. Okay, we try to challenge the body to find out the allergen, why or of which substance allergy children is having. But this test needs to be conducted in a very controlled environment, mostly in the hospitals, so that if any untoward event happens, so that can be tackled in hospital. Okay, so these are the common tests generally we do to identify the allergy in the children's, and once the allergen gets identified, we try to avoid that allergen in the children's. Okay, so how we are getting diagnosis of these allergens, so we came to know. And now how the treatment part of these allergies, how to treat these allergies. Okay, so these allergies generally most of the time can be managed on the OPD basis. Okay, so as I told previously in the introduction, there is a chemical kind called as histamine, which is responsible most of the time for the this kind of allergies. So we try to give the medications against that chemical, so that the response of the allergy can be decreased with that. So simple OPD basic medications we try to give and try to reduce the allergy. Okay, and then if that is not helping, then we have to consider for the mild dose of steroid. Okay, so that again helps in suppressing the immunity response of the body. In certain cases, like as I told, in life threatening events, we have to use strong steroid and adrenaline injections to prevent life threatening events in the children. In certain cases, one therapy known as desensitization therapies, we generally try to use to desensitize body against the particular antigens or particular allergens, mostly in cases of the airborne like pollen, dust, mites, all these things can be helpful, but not in case of the food allergy. So this is how we treat allergies in the children's. And Now, the prevention part. Generally, parents ask how I can prevent allergies in the children. So, very simple. And if you have the allergic tendency in the family, you are known for the allergies, like in father or mother. So you need to follow simple steps. Firstly, you need to exclusively breastfeed the baby till 6 months of the age. No food introduction before 6 months. That is the most important, because a lot of allergens get introduced if you don't breastfeed the child before till 6 months, so that can be avoided. And particular substance like milk, cow's milk, buffalo's milk should be introduced after 1 year of life. The proteins like egg protein, meat, chickens, all these things needs to be introduced after 1 year of the life, so that helps in keeping the response of the body in a check for 1 year, so that body can be ready to handle such kind of the proteins. If you introduce this kind of proteins before 1 year, so there might be chances that the children may mount allergic response to these kind of substances. And when the children are allergic to the dust related or the airborne related allergies, so try to avoid exposures. Try to avoid pets when they are exposed to. I mean, when they are allergic to the pets allergens. Keep health means hygiene in the house. Avoid dust and all these things you need to follow. So this is the basic flow I want to explain to you regarding the allergies, and that's it from my side. I think if you have any questions, please do let me know, so I can answer your questions, and I'll be more happy with that. Okay. So takeaway message from my side. One, first of all, as I discussed now, exclusive breastfeeding for the newborn child till 6 months of the age. No introduction of the foreign proteins like cow's milk, egg, chicken, meat before 1 year of age. Then when you have a familial tendency of the allergy, like known allergy in the father or mother, then you have to be more careful. And when you encounter such kind of the situation, so keep in mind life threatening events like in the form of repeated coughing, there is choking episodes, severe rash over the body, then you have to rush to the hospitals. And always seek doctor's help when before introducing any food to the child, basically of a protein, a kind of a food. So that's the message from my side. I hope this small session will add some value to the parenting. Hmm. Happy parenting, and best luck from my side. So follow me on Baby Chakra, and my referral code you can use DRPRSH. And thank you for the patient listening.